Hello and welcome. Today, we're diving into a condition that affects the bladder fibrosis. We'll explore what it is, how it develops, and what can be done about it. So, what causes bladder fibrosis? Unfortunately, the exact cause often remains unclear. However, there are several known contributing factors. These include chronic inflammation from recurring urinary tract infections, long-term catheter use, radiation therapy to the pelvic region, certain autoimmune diseases, and even complications from bladder surgeries. In some cases, bladder outlet obstruction, such as from an enlarged prostate, can also contribute to its development. Now, let's understand the pathophysiology, or how this condition unfolds within the body. Bladder fibrosis involves the abnormal deposition of collagen and other extracellular matrix proteins within the bladder wall. This buildup leads to thickening and stiffening of the bladder tissue. As the bladder loses its elasticity, its ability to stretch and store urine diminishes significantly. This restricted capacity and impaired compliance are the hallmarks of bladder fibrosis, leading to various uncomfortable symptoms. Regarding epidemiology, it's difficult to pinpoint precise numbers as bladder fibrosis is often underdiagnosed or misdiagnosed. However, it's believed to be more common in individuals with a history of recurrent UTIs, those who have undergone pelvic radiation, or those with long-term indwelling catheters. Age may also play a role, as the risk of developing bladder fibrosis can increase with age, especially in men with prostatic enlargement. The signs and symptoms of bladder fibrosis can significantly impact a person's quality of life. The most common symptoms include frequent urination, both during the day and night urgency, or a sudden and intense need to pain or discomfort in the pelvic area, and sometimes, even urinary incontinence or involuntary leakage of urine. These symptoms can greatly disrupt daily activities and sleep patterns. Diagnosing bladder fibrosis usually involves a combination of methods. A thorough medical history and physical examination are the first steps. Urinalysis helps rule out infection. Urodynamic testing, which measures bladder function and pressure, is crucial in assessing bladder capacity and compliance. Cystoscopy, where a small camera is inserted into the bladder, allows for direct visualization of the bladder lining and can help identify any abnormalities. In some cases, a bladder biopsy may be performed to confirm the presence of fibrosis under a microscope. While bladder fibrosis is generally considered a single condition, the severity and extent of fibrosis can vary, and sometimes it is categorized based on the underlying cause, such as radiation-induced or infection-related fibrosis. However, distinct classifications are not commonly used in clinical practice. Treatment and management of bladder fibrosis aim to alleviate symptoms and improve bladder function. Unfortunately, reversing established fibrosis is often challenging. Treatment options may include medications to relax the bladder muscles, pain management strategies, and bladder training techniques to improve bladder control. Intermittent catheterization may be necessary to ensure complete bladder emptying. In severe cases, surgical options, such as bladder augmentation or urinary diversion, may be considered. Bladder augmentation involves increasing the bladder's capacity using a piece of bowel, while urinary diversion reroutes the flow of urine to bypass the bladder entirely. Preventing bladder fibrosis can be challenging, but there are steps that can be taken to reduce the risk. Prompt and effective treatment of urinary tract infections is essential. Minimizing unnecessary catheter use and ensuring proper catheter care are also important. Following recommended guidelines for radiation therapy and managing underlying autoimmune conditions can also help mitigate the risk. The prognosis for bladder fibrosis varies depending on the severity of the condition and the individual's response to treatment. While a complete cure may not always be possible, management strategies can significantly improve symptoms and quality of life. Recent research is focused on developing new therapies that can target the fibrotic process and potentially reverse some of the damage. This includes exploring antifibrotic medications and regenerative medicine approaches. Further research is needed to better understand the underlying mechanisms of bladder fibrosis and to develop more effective treatments.